everyone. Today we're going to talk about art therapy and anxiety and depression. Many Americans suffer from anxiety or depression, and about 3.1% of Americans have a generalized anxiety disorder, and about 8% have some type of depression. Many people are looking for alternative treatments for non-psychotic disorders like anxiety and depression. One of those alternatives is art therapy. Art therapy has an element that talk therapies don't have. Patients have a way to communicate without having to speak with words. It allows for a bridge of communication to be built between the client and their therapist without actually talking. It can be difficult for some people to open up to a complete stranger, and some people also have trouble putting into words how they're exactly feeling. But with art therapy, they can express their feelings and externalize their feelings onto paper, which can be very beneficial. And when they externalize their feelings, it gives them a sense of relief. When someone is incapable of expressing their feelings or troubles or challenges, art therapy allows them to communicate in a non-threatening, non-hostile, and non-invasive way. People are able to physically see their progress as they're working through a traumatic experience or a mental health problem. Another benefit of art therapy is that it is a great form of self-care, and it's also inexpensive because art supplies do not cost that much, and you're able to do it in your own home. Art therapy could be the future and alternative treatment for non-psychotic disorders such as anxiety and depression. Like Pablo Picasso once said, art washes from the soul the dust of everyday life. I have Karen Stabley here with me, who is a licensed art therapist, and she also teaches the art therapy course at York College. So Karen, what made you want to become an art therapist?
Um, well, my undergraduate degree is in fine art. I have a BFA at Rutgers University, and then I realized that I did not want to do what my classmates were doing. They were going into New York and becoming artists, and I had a really interesting art history teacher who talked about the symbolism in art, and that's what got me interested in art therapy. And then I went on to hospital, graduate school in art therapy, and I have a master's in creative arts and therapy.
Okay, how do you think art therapy can be used to manage anxiety and depression?
Well, that's a huge question because it depends on the individual. And, and I do an art assessment. So the client will start by drawing at least 10 to 15 drawings. And then once we've completed the drawings, then I'll be able to tell which tools and material would help to deal with anxiety or depression or underlying sadness. So it's really dependent on the person. It's not like, oh, use this to alleviate anxiety. It's not that simple.
Uh-huh. Do you think art therapy is a little bit more effective than just talk therapy alone?
I I do. I often say that I don't know. I mean, I clearly was trained as a verbal therapist as well, but I don't know what I would do without the artwork. I think the artwork helps people to get to the issues a little quicker. So the whole therapy process goes a lot more quickly with art therapy.
Yeah, I agree. What mediums do you like to use with your clients?
I use paint. I use clay. I use any art material that you can think of. With a lot of my grief and loss clients, we're making altered books. So it's whatever art material that you can think of is what I use.
Okay. Do you think art therapy is pretty affordable?
Well, our therapists are allowed to take insurance clients. We fall under the marriage and family therapy and the social work umbrella in Pennsylvania. So we can be licensed professional counselors, LPCs. So we can take most insurances. I only take one insurance just because I work independently and it's a lot of paperwork involved with it.
Yeah. What are like the most common problems that you normally treat?
Anything that anybody would go to a verbal therapist. So I have a lot of anxiety, clients with anxiety, and I see both children and adults. So it's the same kind of issues. So anxiety, depression, transition, a lot of grief and loss. Those ADHD in kids or families that are going through a divorce.
Yeah. And what do you think the major benefits of art therapy is for people with anxiety or depression?
Well, the major benefit is that it helps them, they can see their progress through their drawings. So the drawings I collect at the beginning of the time I start seeing them, that's a baseline of where they're at emotionally and developmentally. And then at the end of therapy, I will ask for another series of drawings. So they're able to really see their progress. And it really is helpful, too. Sometimes people don't have words for what it is that they're struggling with. So the art acts as a bridge to help them to get to the point where they are able to talk about their issues and what they're struggling with.
Yeah. Thank you so much for talking with me today.
Thanks for thinking of me.
Yeah, no problem. Once again, that was Karen Stabley. And that concludes this podcast. I hope you all enjoyed it. Thank you for listening.